Some crazy stuff I've learned the past few weeks. I remember how things were before we had chemical sedation, procedural sedation, not constant sedation. For children, we used to hold them down and do a procedure. We used to have something called a papoose. But the papoose never had a head wrap. Like the forehead, face, like something I wish we had for trauma patients in the CAT scanner. It was more for the arms and legs so we didn't get punched in the face or kicked. But the head keeps moving like you have an exorcist or a child with a possessed demon. It's hard to do a lack of the eyebrow or the lip. Sometimes it's too complicated. You have to take it to a place that you may have to be done in the operating room. Shared decision making, patient shared decision making with the parent for a 4-year-old with a lack over vermilion border. Like right here. This little line right here. Right here. The line right here. It's more noticeable because of my exaggerated lip gesture and my facial hair. Right here. If I could do 1 or 2 stitches, and if it could be done quickly without giving an IV or giving medications to a patient, you have to give the pros and cons to the patient's family. And the father said, I don't want him sedated. He waited a while because I had other patients coming in, belly pains, shortness of breath, neck pain. I had to see them. I had to figure out who was sick. I could have let them pile up and just take care of him quickly and ignore everyone else, but that's the life of an ER doc, right? So, with the help of the father and the help of the nurse and an assistant, we were able to keep the face stiff as much as possible for the numbing part, local block. I was trying to do like a mental block, but I was like, you know what? It may take too much time. I just did it local. Next time I'll do a mental block. But I did it local to the lip. He moved. I was like, oh my God. I don't know if the needle can get stabbed. I have to be careful. I'm not hurting the patient either, or hurting the father or whoever's holding the patient's head. Calm down. Do a first stitch, the first one, the hardest one, involving the vermilion border. Got that matched. Some people don't know how clear it is. And at the coordinate, they put a marker to mark off where it should meet. Mine's met. Still a little hole there. One more stitch. Woof! You just have to tolerate the yell of a banshee. If you're from the Great Isles, I think the Irish, Scottish, English, banshees were spirits that can shrill so loud you think they wake up the dead. They'd even possibly cause a zombie who's trying to kill you and eat you and bite you to stay still. Your eardrum is like... Even after we took care of the patient, the lip light got done and taken care of, and he got a little bit of oral Tylenol and oral ibuprofen liquid, and he calmed down with the popsicle stick. You still hear the yells. So maybe the father will reconsider next time. But thankfully for the papoose, thankfully with the shared decision making, thankfully the nurse is willing to help me to deal with the same PTSD that I got from hearing the yells. But it got done. The yell of a banshee from a child. Oh my God. I had forgotten those yells. Raising 2 kids when they were little kids. When they were very, very small as babies. The banshee yells. Oh my God. That would be the best, greatest alarm ever to wake up. You'd probably died of a heart attack or arrhythmia listening to that, waking up.